for children and families to access healthy foods in their neighborhood, to live in homes that are free of pests and mold and things that could trigger asthma. They're really just working with the expertise of many different people, thinking about how to keep children and families healthy, especially in North Shore neighborhoods. We have pivoted as a group and are really thinking about COVID-19 and how this new challenge is putting increased pressure on families. So we really are very excited to explore this topic with Heather and to think about how we as partners can really work together to address these very specific needs and tap into our expertise and resources.
Okay, great. Thank you, Adrienne.
Yeah.
And do you want to say anything else, Adrienne?
Well, I mean, we hope that people are continuing to social distance and are washing hands and are thinking about friends and neighbors who are isolated. I know this is very hard for many of us who are strong or extroverts and empaths and want to go out and wrap our arms around the world, around our neighbors and our loved ones. So just to be mindful of that. And in general, we're also trying as an agency to direct people to the most update and current information on this. I know things are changing with the hour. So just we're counseling people to go to the City Health Department site for the latest around COVID-19 responses. There's also the governor's site. Sometimes they're a little at odds. So we've been using the most restrictive, which is the city, also because we know the very specific needs of our community. So we always kind of feel that local is best. So those are some of my updates. I don't know if Sarah or Darcy want to add anything around specifically what CWI is doing right now.
Anything else anybody from SIPCW wants to add?
Nope. I'm going to put our emails in the chat box. If you'd like some more information, I've also included the website. I'm going to pass the ball to you, Heather. We're really looking forward to this webinar, and thank you again.
All right, great, good. So my name is Heather Butts, and I'm going to give you a little bit of introduction about myself. I thought a lot about this webinar and exactly how I wanted to tackle it. And so I think that, you know, in thinking through it and what I wanted to really focus on, Adrienne actually said it. I was really interested in focusing on issues regarding the family and also issues regarding the family as it relates to children, and then basically thinking through how we talk about COVID-19 with children, what are some of the issues that come up with them specifically, but then honestly, just dealing generally with how this impacts on all of us. So I've done this webinar in various forms over the last week a few times. So some of what I will talk about, if you've heard my webinar before, you might tell yourself, I heard that before. You might. It might be familiar to you. And then some of it's going to be a little different. And then I would like for everybody, right now, everybody is on mute. But what I would like for people to do is, as we're going along, put questions in the chat, which I can see. And then at the end, I will answer questions. And then as we go along, if I see specific questions that really need to be focused on, I'm happy to do that as well, okay? So just a little bit about me. I received my bachelor's degree at Princeton University, my law degree at St. John's University School of Law, so I'm a lawyer by training, and my focus is public health and public health law. I received my master's of public health degree from Harvard University School of Public Health, and my teaching degree focusing on child and adolescent psychology. So I'll talk a decent amount about that today as well, from Columbia University Teachers College. I'm currently a public health law professor, and I run a nonprofit called Help for Youths that does most of its work on Staten Island, and we focus on issues around young people and their healthcare issues from a holistic standpoint. So obviously COVID-19 is of interest to us personally just because of the population that we serve. And before I go on, I just wanted to again thank SIPCW for their support over the years and their unwavering commitment to help on Staten Island. Organizations like mine really can't do what we do without organizations like SIPCW. I'm very much sort of a hands-on person. I was actually today, I don't know if you can see this little free library here, but I was, I had to go get it from Staten Island. It had been injured by someone. And so a lot of the work that I do is very much, sort of hands-on. And I do a lot that's in real time. And I'm not afraid to just hop out there and start doing things. It's kind of my personality. It's what I do. And so to have supportive organizations like SIPCW that can allow you the space to be intentional and thoughtful about the work that you do is gratifying, and I would say highly necessary. So I really thank them for that. So preliminary questions, if you have them, feel free to put them in the chat. And then as I go along, I will definitely answer them. And then I will for sure answer them at the end. So hopefully you'll have questions at the end as well. Okay, so definitions. And I'm going to give you some definitions, but I really want everyone to think about these definitions from the perspective of children and how you would break these things down. I hate to say it, but if you have children or you're dealing with children of a certain age, they're going to know some of these definitions more than us, more than adults. And I think that's why I thought a lot about this presentation, because I think we are under a misapprehension or misunderstanding that children somehow, they don't know, they don't get it, they're not aware, they're not clued in. They're more clued in than a lot of adults that I know, especially about COVID-19, the biology behind it. I mean, I might trust a fifth grader in terms of their understanding of what a virus is a lot more than some adults I know. So make no mistake, children are getting there and they understand a lot more than often they're given credit for. So when we're going through this, just say to yourself that there's probably a decent amount of children that know these definitions in ways that we wouldn't. So when you're thinking about how you want to talk with the children in your life about some of these things, I would approach it actually from a standpoint that they may already have a decent understanding of some of this. And so really having a conversation with them, not a talking at them session, which is not going to be helpful and probably won't be productive. All right, so we're going to define virus, COVID-19, social distancing, infectious contagious diseases, quarantine, isolation, outbreaks, epidemics, pandemics. So we're going to discuss all of that. Okay, so COVID-19, I probably don't need to tell many of you this anymore. COVID-19 is the disease. The actual virus is a SARS type virus, and COVID-19, the disease, it's a respiratory illness, as most of us know, spread from one person to another, and it was identified in Wuhan, China. It is called COVID-19 because it stands for, the CO is corona, the BI is virus, and the D is disease. Okay, so that is COVID-19. But wait, what is a virus? And again, I think if you asked most young people, they'd probably be able to answer this. A lot of adults that I know, I think is going to be a little more challenging for them. So a virus is a biological agent, and it reproduces inside the cell of a living host. And when you're talking with children about these things, I would definitely gauge what they know already. Certainly a young person in high school who might be taking biology right now or have taken biology very recently probably has a decent working knowledge of this. So they might be able to teach you a thing or two. Again, the reason why a virus is so deadly is because once it infects a host cell, it reproduces thousands of identical copies of that original virus. And again, they're not actually identical, which is how we get mutations, but they're pretty close. They're like a carbon copy, as I often refer to them as. So they're pretty close. They're pretty close. Okay, this is what COVID-19 looks like. We've all probably seen it at this point, more than we'd want to see it. And that brings me to another point, which is, I feel like some people think, oh my gosh, like I'm so over COVID-19 already, and it's only been day 3 of my being locked up in my house. We probably have a long way to go. And so we got to think about this in terms of time and what that's going to look like, and how you can see this through yourself and with your children in a way that's going to be sort of like the longer version of this, and basically see it through. But it's going to be for a little while, okay? Social distancing, a public health practice aims to prevent sick people from coming into contact with healthy people in order to reduce opportunities for disease transmission. And right, it can include, but we've already seen the measures that are being taken at both the super hyper local level, the local level, the federal level, in terms of canceling events, closing spaces, and then just avoiding large crowds. Why is social distancing important? Slows down the outbreak, reduces chance of infection, reduces burden to the healthcare system, and it flattens the curve, which now we see flattening the curve everywhere, right? It's a hashtag. If you're driving anywhere, it's on all the highways. At BQE, you can't go a mile without seeing flattening the curve flashing before you. So of the many phrases that we're getting very used to hearing, flattening the curve is one of them. And here's an example of that. The big blip is basically uncontrolled transmission. The smaller one is flattening the curve, with the line being the healthcare system's capacity. And again, the healthcare system is decently maxed out now. I mean, it was maxed out 4 months ago, more or less. The healthcare system in the United States doesn't have a whole lot of wiggle room. So when we think about the fact that it doesn't have a whole lot of wiggle room, and then we add to it something like COVID-19, the big issue here is making sure the healthcare system can absorb what's coming its way. And that's why, COVID-19 wouldn't be so much of an impending disaster if we had infinite resources. But because we don't, because the healthcare system can't absorb the high peak, that's what the real fear is that you'll get people who maybe weren't even that sick coming into a hospital or being at home and needing some care, but because the system can't absorb it, they will become more ill. So that's a huge fear. And that fear is not to be discounted. It's something that we should all be thinking about very carefully. All right, quarantine versus isolation. I keep hearing this used interchangeably too. I actually just saw it in a tweet from Rand Paul's office where they were talking about he was under quarantine. No, he has COVID-19. He has transitioned to something called isolation. So quarantine is when you restrict the movement of people exposed to a contagious disease. So people have been exposed, but they don't actually have the disease. Isolation is when you keep a patient who you know to have a disease. You know that it has the disease. They have the disease, spreading it to other people. So those are two very different things, and it's important to distinguish those two because terms matter and words matter. And so if somebody's talking about a quarantine, if somebody were talking to me about somebody being under quarantine, my working assumption would be that they didn't actually have the disease. And so knowing that somebody actually has the disease is important in terms of their care, in terms of triage, in terms of lots of different things, in terms of what that means from a legal perspective, and what we'll talk about for a second. So that's important. Question. Flattening the curve doesn't reduce the number of cases that spreads applications to prevent overwhelming the system. Is that right? That is a great question, Adrian. So the hope, unfortunately, over a longer period of time, we potentially could have the same number of cases. So let's say we could predict that in the United States, there were going to be 3 million cases of COVID-19. Let's just say that's how it was. We just knew one way or the other, we're going to get 3 million cases. And that, let's say that were the case. if we could spread that out over 18 months, that's a very different thing than if those 3 million cases happened in 3 months. So the big thing that Flattening the Curve wants to do is just spread out the cases over time. That's what it wants to do. If Flattening the Curve can also lessen the number of cases, so 3 million is 2 million, that's great. But ultimately what we want to do, I mean, I think flattening the curve, the way we hear about it, is sort of like the peppy version of it. Oh yeah, flatten the curve, and then we won't have as many cases. It'll be great. I mean, that's the ideal. The ideal is that we have less cases and they happen over a longer amount of time. That's the ideal. If we can't do that though, the second ideal is to have the same number of cases, but they are spread out over a longer amount of time. So social distancing kind of says, okay, Bob, okay, Susie, you might get COVID-19. There's a decent chance you might. But if you get it in January of 2020, that's a lot easier for us than if both of you get it next week. So we can handle you getting it in January 2021, and then maybe you, Bob, getting it in December 2021, because then we can spread the care out over time. That would be more optimal. But flattening the curve ultimately means you get the number of cases that corresponds, and it shows it. You get the number of cases that corresponds with what the healthcare system can actually bear. That's the goal. Okay, so another question. Talk a bit about caring for multiple children at home if you have one child who's sick or has a positive COVID-19 result. Okay, yeah. So I'm gonna get to that a little bit, but let's talk about it now, because what I'm gonna get to has to do with if you are a parent and you are ill, or you have two parents and they're ill, what do you do? But right, yeah. So if you have children in the home and one of them is sick, one of the things you need to do is essentially set up a system whereby you have one person that is taking care for that child. So let's say you have 3 children, one child is sick, the other 2 aren't. You should basically have a sort of like COVID-19 room where that child basically doesn't move. It could be a second bedroom, hopefully, if you have it. It could be a spare room. If it's just the room where, the child shares a room with another child, move the other child out of there and have that one child in there. But you should essentially have one space where the child that is ill stays and everybody else is out of that space. And then you have one caretaker that's caring for that one sick child, and then nobody else is caring for that sick child. Nobody else is spending time with them. It's basically just whatever caretaker is designated in that child, and they're caring for that child. And then that also goes into how the home should be set up in terms of making sure that you're washing the doorknobs frequently, making sure that the bathroom is the way it should be, making sure that you're disinfecting the house as much as possible. But ideally, if that child is basically relegated to that one room, then it's easier to do a lot of that than if the child is not. And I think in the next slide or two, we're actually going to get more into that. Okay, myths, there are a lot of them. Do your children have any? How many of you have actually sat down with your children and said, Bob, Susie, and I always use Bob, Susie, Bob, Susie, what myths do you have about COVID-19? What do you think this is? You can sort of think to yourself, if you have had that conversation with your children, I'd be interested in hearing about it. Put something in the chat about, yeah, I had a talk with my children. I think, again, most adults are so terrified about COVID-19, it's hard for them to have a conversation with themselves about it, much less sit down and have a conversation with their 13-year-old. So I think it behooves all of us to be able to try and do that to the extent that we can, and think about what we would say. And one of the first things I would say to a child would be, what have you heard? What do you know? What do you know this to be true? What are the rumors you heard? What are your classmates talking about? I mean, one thing that disturbed me was when I heard about boomer eraser. which some of you probably have heard about, but this is basically what some young people in the earlier days of COVID-19 were calling COVID-19, because basically a myth was that it only impacted older people. We obviously know that not to be true, but something like that, again, words matter. And so when people think that, you know, a disease only affects people over the age of 80, well, they're probably not going to worry so much about themselves, because that, you know, that's what, right. And then, you know, what makes a myth a myth? That's a great question, right? And how do we frame things so that they even become a myth? I mean, sometimes myths become myths because it makes us feel better about the situation. So if I'm 15 years old, it might make me feel better to call COVID-19 boomer eraser, because then that makes me feel like I don't have as much of a chance at getting it, right? So why do we even need myths? Sometimes they can be defense mechanisms. They can be things that we can use in order to make ourselves feel better about a situation. It can be a psychological coping mechanism, so that we can say to ourselves, oh, well, I will use this because, you know, that will make me feel better. Right. Also, a problem with societal attitude is that it doesn't matter if older people die. Exactly. Right. So if we've decided that people over the age of 95 are useless anyway, then who cares if we no longer have them in society? What are they doing for us? Rationing of care. It's a slippery slope, because then it leads us down the road where we think certain things are acceptable when they really probably aren't. And that's problematic. Of the things that I teach bioethics. I teach bioethics, I teach public health law, I teach health law. And when I teach bioethics, one of the things I ask students to say is, does everyone deserve health care? All right, so let's ask that question. How many of you think everyone deserves health care? Put that in the chat if you would. Yes. Give me a lot of yeses, I think. Yes, 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 yes. Yeah, sure. Everybody deserves health care. Definitely yes. Okay. So then here's my next question for you. Let's say I told you, and you can do this exercise with like your children. Let's say I told you that I didn't like my earlobes. I mean, I think my earlobes are fine. I think they are. I don't know. If they're not, don't tell me. But let's say I told you I didn't like my earlobes and I needed to get surgery. I felt like I needed surgery in order to fix them, because psychologically it pains me to look at myself in the mirror every day and see my earlobes look the way they do. How many people would say, yep, insurance should pay for me to get that surgery? What are the yeses? Yes, yes, yes. Not as fast on the yeses, huh? Not quite as zippy. Right, but I could make a very good argument. I'm a lawyer. I could make a very good argument that that's maybe. Yeah, right. I could make an exquisite argument that that's healthcare. As much as other cosmetic surgery would be, as much as lots of things are healthcare, it's the care. Right, exactly. So what you first have to do is define healthcare. And again, you could do this with your children. What's the definition of healthcare? See, remember, the first thing I said was, does everyone deserve healthcare? And nobody asked me to find it at that point. Everybody's like, yep, 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 yep. Okay? When I then made it a little bit more nuanced in terms of my earlobe example, then all of a sudden people were like, well, wait a minute. Is that really healthcare? And I'm sure there's someone out there that's thinking to themselves, look, lady, you and your earlobes can keep it moving. I don't think that meets the definition of healthcare, and I certainly don't think insurance should pay for it. So then if I ask again, does everybody deserve healthcare? The yeses might not be quite as so zippy and peppy, because now we're thinking to ourselves, well, wait a minute, what exactly do I mean by healthcare? Do I mean the earlobe example? Or do I mean I just got hit by the Q46 bus and I broke my arm and my pelvis and I need to be taken to the ER? So that's an issue. So then when we think about, does everybody deserve healthcare, the next question becomes, if everybody does not deserve healthcare, then one, who deserves it? And two, what does that look like, right? And you can see a slippery slope where some people might say, oh, but wait a minute, I don't know if a 95-year-old actually deserves, a kidney transplant. right? Or I'm not sure if like a 62-year-old should get that earlobe procedure. So then it becomes even trickier. And I guarantee you this, the next interesting ethical place that we're going to go with respect to COVID-19 are going to be these bioethical questions in terms of, so I'm 95, there's 3 ventilators in the hospital left, but there's 4 people that need them. Should the 95-year-old get them? That is going to be decently dicey. That's what I do for a living. It's what I've been doing for like a long time. That's what I teach. It's what I do. It's what I think about. It's what I study. Those very questions right there, in terms of the rationing and what that's going to look like. But I'll be honest with you, until about 2 months ago, I thought my life would be lived doing my nonprofit work and theoretically thinking about these. Well, it's not theoretical anymore. So when we think about things like boomer remover and who makes those decisions and who asks those questions, well, we're in it now. And those decisions are going to be made in real time in hospitals and facilities. And so to the extent that we're all a part of what that looks like, I would say webinars like this can be helpful. Okay, so this is what I thought was kind of interesting. And I don't know if a lot of people have thought about this. What happens if you have a partner and both you and your partner get sick? How many of you have actually thought about what you're gonna do? Right, and while you think about that, do medical professionals make those decisions and or policymakers? Well, it depends. If you're at a hospital and the hospital has a policy in place that deals with that, well, you're in good shape. But if you don't, then some of that is going to sort of be a little determined by some other factors. And again, so I specifically deal in the realm of health policy. The division that I work in, what I teach in is health policy. So that's my life's work. And, you know, there are answers, actually. There are answers, because people make these decisions all the time. The question is just who answers them. And some of it is policy making. And again, I tell my students now, my public health law class and in my healthcare policy class, let me tell you something, you are the new future of like jobs in this country. Because I think a lot of people are going to be very interested in, when we're done with COVID-19, there will be an end, but when we are done, I think a lot of people are going to be very interested in being part of answering these questions, very interested. And so a lot of it is at the policy level. A lot of it is at the academic level. A lot of it is at the research level. A lot of it is at the hospital level, at the very hospital level. That's where some of this is. So, all right, so now back to my question. So, keeping children healthy if you and your partner are sick. How many of you have thought about this? How many of you thought to yourself, and if you're a single parent, I would say this is even more critical for you. If your child got sick and you are if you got sick and you are a single parent, or if you got sick and your partner is far enough away that it would be difficult for them to travel, or if your partner got sick and you got sick, how would you safeguard your children? What do you have in place? And I would imagine that a lot of people don't have very much in place. I'm sure that people don't have a lot legally in place. Do you have anything in the way of guardianship for your children? Have you thought about it? Have you talked with your partner about, if I get sick and you get sick and the kids are left on their own, what will we do? Who will we care for them? And remember, we're in a precarious situation now where people over the age of 70 are probably not the caretakers you want to look to. So if you're thinking about your mom, or you're thinking about your dad, and you're thinking about your grandmother, and you're thinking about your grandfather, well, that's not really an option, right? So you're going to have to look to people of a certain age group, probably that don't have kids themselves, but are responsible and not flighty, that can actually care for your children. Have you talked with these people about that? So I would say anybody on this call that has children, look within yourself and ask yourself if you've had these conversations. I do a lot of work with people around like issues like healthcare proxy and guardianship. And remember, when you have children, parental permission flows through you. So the consent process for your children is you. But if you're not available or around or physically able to make those decisions, then somebody else is going to have to make those decisions for your children. And so I would say it definitely is important for you to think about that now, before potentially you get too ill, or your partner gets too ill, or both of you become too ill to make those decisions. Okay. And I wouldn't leave it up to just sort of, luck or chance, or I hope I don't get sick. You should think about it now. Other issues: keeping high traffic areas clean, separating bathrooms. I mean, if you're living in a situation right now where you have multiple bathrooms, where I live, actually, I have 2 bathrooms. So I'm fortunate, even though I have 2 bathrooms and it's just me. So that's a bit much, I guess. But if you have a family, ideally you have 2 bathrooms. That'd be great if you do. 1 bathroom for the people that become ill, 1 bathroom for the people that are not ill. But if you don't, you're going to have to keep that bathroom spick and span, super, super, super clean. Okay? Because the people that are ill are going to be using it at the same time that people are not. And if your child is ill, if you have 1 child that's ill, but you have 3 children, you don't want the other ones to get infected because you've done everything you can to isolate the ill child, but then the ill child using the bathroom, and now, boom, they're sick. And remember, I mentioned this on another webinar, but when you flush the toilet, make sure you keep the lid down. I mean, this gets a little like, ugh, but fecal matter travels. And so if you have anything exposed, I mean, the best example is toothbrushes. And a decent number of studies have shown fecal matter on toothbrushes. And so, I mean, you should just do that regularly. Like even after COVID-19, or like while COVID-19 is going on, that is not what you want on your toothbrush. But if you have anything exposed in your bathroom, you should put it in cabinets, keep it locked up, keep it closed, because what you don't want to have happen is for matter from the toilet to get on to that. And that's pretty much anything that's exposed in your bathroom that's not locked up or in a pantry or otherwise safeguarded. Okay, so that's another thing to think about. Activities for children. How does that happen? I guess, how does that happen with the fecal matter? You flush the toilet, the fecal matter flows from the toilet, and it's particles. And so then the fecal matter gets on the things in, fecal matter on toothbrushes. You flush the toilet, the fecal matter, I'm not talking about like, I mean, this gets really, I'm not talking about large clumps of fecal matter. I'm talking about the small specks of fecal matter can get on your toothbrush. Yes, absolutely, 100%. So you flush the toilet and the fecal matter comes up from the toilet and it can get on the items in your bathroom.
That's why they say to put the lid down when you flush. Put the lid down and flush.
Right, exactly. So that's a main reason why you want to keep the lid down when you flush the toilet, because then it can get on both surfaces. And I think most people would be most horrified by the fact that it can get on your toothbrush, which is most people, I don't know why, but they keep their toothbrushes not locked up. They keep their toothbrushes out in the open in their bathroom. And so also for your children, right. So for your children, that's a good habit to teach them right now. It's like, hey, Bobby and Susie, we're going to put our toothbrushes away in the cabinet. We're not going to keep them out where they can be exposed to fecal matter. So, okay. Activities for your children. I mean, there's lots of things potentially you can do with your children. One of the things that my nonprofit's doing, we're doing a lot of programming for young people. And we actually have a soccer program that we run. And usually it's every Saturday at IS 49. So when we get back into business, I'd love to see you all there if you have children. But we're going to start doing online soccer, doing drills and doing other programming with them. So I will make resources available not only for my programming, but other programs. So if you have kids that are super sporty, there's lots you can do. That doesn't mean you have to be outside doing it. And you can go with your kids for a walk. I mean, there's been a lot of buzz lately in terms of like the parks, and I know Governor Cuomo has been talking a decent amount regarding the parks and social distancing. So if you're going to be in a park, make sure that you are keeping your distance from other people. He has a great line that I'll get to, that's basically like, social distancing is not playing basketball with a bunch of people or sitting at a park with like 10 people. It's not. So if you want to take your child to the park, just do it in a manner that's safe and will safeguard them. There's all sorts of online science projects, and I'm gonna create a resource list for everybody that I'm happy to share, and I can give you all of this. I mean, the most important activity for your children right now is their safety. Safeguarding them, being present with them, talking with them about what's going on. I mean, like distractions are one thing, but I mean, I'm a pretty straightforward person. And so I believe in being straightforward with young people because, again, it's not like they don't know what's going on. They know what's going on, and they know that it's catastrophic. I mean, they've noticed that they haven't been outside and they aren't going to school and they're not playing with their friends and they're not going to soccer. They figured that out. They got the memo, right? And they're picking up on your energy and they're picking up on what you're talking about with your friends when you think you're whispering, but you're really not whispering. So they're not stupid. They get it. And so to the extent that you can safeguard them, you can be honest with them, you can talk with them about what their fears and concerns are, that's one of the best things you can do. And then, are your children introverts? Are they extroverts? How are they dealing with this? That's important to know because, if you have a pretty extroverted child who's used to sort of like being out in the world and talking with people and socializing and so forth, they're going to filter this in a different way than an introverted child, both in terms of what they're communicating to you, and then also just sort of like how they're dealing with it. So an extroverted child's probably going to be decently just more stressed about the fact that they can't be hanging out with their friends and being around people and so forth. An introverted child may not be as stressed about it. So knowing your children and knowing how they're coping with it is going to be really helpful in this situation. Right. So how are your children, dealing with it? Are they talking? Are they worried? What activities can you do? I will give you a resource list regarding all of this. And right, yeah, well, right. So Cuomo also mentioned closing roads and makes more space available for people to walk. One of the sort of like the disconnects between Cuomo and de Blasio was that de Blasio had an interesting point, which was, that's good and well, but now you got a social distancing issue, right? So let's say you close the roads, so then you got space for people to walk, you almost create these like plazas. And then can you actually effectively make sure that people are keeping 6 feet of distance between them? So that's going to be interesting to see if that actually happens. And then if it does, are people going to keep their distance from each other, or is it going to become sort of like a mosh pit of people? So we'll have to look at that because that's what's a little bit starting to happen with the parks, unfortunately. So yeah, this just goes into, I think I'm going to like sort of speed through the rest of the slides. I want to take a minute just to talk about the pause that Governor Cuomo, the executive order that he put into place, because it affects families. And then I think I will take some questions. All right, so this just goes into some more definitions. Hopefully you know the difference between, an outbreak is a disease that has a sudden increase in the number of cases versus an epidemic, a broader outbreak in a larger geographic area, and a pandemic, an epidemic that has an impact on multiple countries. So again, when you're talking with your children, it's good to be able to use the right definition. So your child may know these. She or he may say, oh yeah, this is a pandemic. And you might be like, what? Is it? Thank you. But definitions are important, especially when you're talking with your children. This just goes into the exact cases, which is outdated probably since 2 minutes ago. these goes into symptoms more, and I don't think I need to go over a lot of this so much. I'll make this available to you, by the way. So, you know, don't worry about that so much. But I'll make it available. I noticed Adrian asked a question. If we're already isolating for a stretch of time and asymptomatic, how often do we need to disinfect all the surfaces? Well, so there's a really great article from a bunch of Princeton researchers, and I will make this available to you as well, that talks about the fact that COVID-19 lives in the air for approximately 2.7 hours. So now, what is the thing that is more safeguarding us? Why has COVID-19 not turned into something like measles or chickenpox? Well, the reason is because of gravity. COVID-19 is heavy. We're looking out there. It's heavy. Measles and chickenpox are light. The measles is a light virus. So COVID-19, the reason why people talk about 6 feet of distance, and I don't know if people necessarily know this, but once COVID-19 travels about 6 feet, just falls from the air. As opposed to measles, that's light as a feather and legit could float on a dust particle, on a feather. It's very light, which is why measles has a larger range, a larger reach. So, you know, making sure that your kids are involved with you in terms of cleaning surfaces, it's important, because while you might not exhibit symptoms, if you have multiple people in your household, they may not be exhibiting them at first either. However, at some point they may. And the time between how contagious you can be and then exhibiting symptoms could be several days. And so what you don't want to do is to be contagious, not have exhibited symptoms, and all of a sudden you pop up with some symptoms. So I would say in this time, just keeping yourself keeping your home disinfected is really critical. It's really important. Okay. Yeah, the role of masks. So this is a little bit controversial, right? You know, healthcare workers really need these masks, and I would say that I would only get things like masks of that level once I talked with a healthcare professional. And I would also talk with them about what your family's exposure is, because again, it's dicey, and because a lot of these things are in shorter supply, we really want to make sure that people on the front lines have what they need. And I talked about masks on another webinar, but you know, again, people are not used to wearing masks. They're just not. And so you gotta be really careful when you wear a mask to not infect yourself. So normally what do people do? They put a mask on, they leave it there for a while, but it's uncomfortable, so they start to fiddle with it. And so unless you're washing your hands really thoroughly, like all the time, there's a possibility that you could actually touch your face, touching your mask, and then you can infect yourself. You touch your eyes, you know, unintentionally touch your nose. So you got to be really careful when you're dealing in the world of wearing masks, because there's a chance, don't worry, I washed my hands before I started this, but there's a decent chance that you could can infect yourself even by fiddling with the mask. Okay, so you need to be very careful about that. And again, most of us just aren't used to wearing masks, so we're not going to be comfortable wearing them, and you know, it's going to be challenging. Okay, so I want to get to the governor's press conference on March 20th, and then I will open it up for questions because we've got about 11 minutes left. So this was actually a pretty important press conference, and in it, Governor Cuomo passed something called, he passed an executive order, and then he passed something called pause. And this is extremely important for your children, for you, for families, to understand what the do's and don'ts are at this point in New York State. So Looking for more beds. Yeah, these are some places that are being looked at in terms of more beds for people that become ill. We're looking for more ventilators. These were the cases as of March 20th, but as we know now, we've surpassed these numbers. And New York remains the state with the largest number of known cases. You got to put that in preface because this is just what we know to be true. All right, PAWS stands for Policies to Assure Uniform Safety for Everyone. And as Governor Cuomo mentioned, this is not a shelter-in-place order. And in fact, that terminology we see used in issues like active shooters, for example. So it is really more in terms of where you can and cannot go, where your children can and cannot go, what you can and cannot do. And it took effect last night. So this is what PAWS is. 100% of non-essential workers must stay home. That's in effect as of today. Non-essential businesses closing, they have. New Yorkers over 70 must remain home. And that's Matilda's law, which we'll get to in a second. Non-essential gatherings of individuals of any size for any reason are canceled or postponed. Any concentration of individuals outside their home must be limited. To provide, providing essential services and social distancing should be practiced. When in public, individuals must practice social distancing of at least 6 feet from others. PAWS goes on. Businesses and entities that provide essential services must implement, facilitate social distancing of 6 feet. Individuals should limit outdoor recreational activities to non-contact activities. Governor Cuomo got really agitated about that. Don't blame him. Individuals should limit use of public transportation to absolutely necessary. Sick individuals should not leave their home unless they receive medical clearance to do so, or after a telehealth visit. Young people should practice social distancing, so this goes to your children, and avoid contact with vulnerable populations. So this is critical for your children. And this is going to go to, like, if there's an elderly person in the household, this is really, really crucial, okay? And alcohol wipes as a precaution. This is a quote from Governor Cuomo, and it's pretty good. Outdoor recreation is not a solitary recreation, is a solitary recreational exercise. Running, hiking, not playing basketball with 5 other people. That's not what it is. It's not laying in a park with 10 other people and sharing a beer. There's certain places in New York where it looks like life as usual. It's not life as usual. He's absolutely correct. It's not life as usual. This is from his press conference on March 20th, on Thursday. Matilda's law. This involves the most vulnerable groups, seniors over 70, immune-compromised people, and those with underlying illnesses. This is going to be critical for your children because if you are in a multi-generational household, so there's grandparents and you and children, this applies to them. They should remain indoors. This is the people over 70. They can go outside for solitary exercise. Remember, that's not playing basketball. That's not sitting in a park with 10 of your friends. Solitary exercise, hiking, walking, 6 feet of distance. They should pre-screen all visitors in age by taking their temperature. And this Matilda is named after Governor Cuomo's mother. And why he wanted to institute this law, he told the story at the presser on Thursday, was his mother's grandchildren really wanted to see her. And he had lots of conversations with his own family about, well, should the kids see grandma and is it advised? And Cuomo said that he talked with a lot of healthcare professionals and they came up with this list, which essentially is like, it's, probably not that advised. Do not visit household with multiple people. Exactly. So if you have a 73-year-old mother and you've got 4 grandkids, she should not be coming over to your house to hang out. All vulnerable persons should wear a mask when in the company of others. To the greatest extent possible, everyone in the presence of the vulnerable people should wear a mask. Always stay at least 6 feet away from individuals. Do not take public transportation unless urgent and absolutely necessary. Okay, so I think that's about it. I'm going to end there, and I would like to take some questions in the 6 minutes that we have left. Does anybody have any questions for me? I saw that was kind of speedy. I just wanted to get through the essentials and also talk about multi-generational families as it relates to Matilda's Law. Does anybody have any questions for me?
I guess I have a question. Should I type it or say it?
Oh, no, say it. Yeah.
Well, I think that a lot of us have concerns about children and families who are under a lot of pressure. Like, I'm just worried about intimate partner violence, domestic violence.
Yep.
Who were at least safe when they were at school,
Yeah.
and things were less stressful in the household.
Mm-hmm.
We're going to see an uptick in a lot of negative health issues, but any resources or tips? Should we be calling people and checking in and providing some resources and lifelines? I don't know. That may be another webinar in itself.
Yeah, I know. It's funny you say that, Adrian, because I think you might know, yesterday I coordinated with Sarah and my nonprofit went to 456 and 476 Richmond Terrace, and we put resource surveys at everybody's door. And so those resources are, because, you know, a lot of people don't have access to they don't necessarily have access to computers. So we allowed people to take a picture of it, like handwrite it and take a picture and get it to us. They can get it to us however they can get it to us. We're trying to get it by email because it's just more streamlined. But we also put links in there to do it electronically. And the hope is that we will be able to, you know, contact with people who right now may still be in a stable situation, but down the road may not. And so to the extent that we're gathering just information generally about what resources people need, we're in the process of doing that. And we also want to gather more resources where people can be able to do that. Now, the problem that I think you're alluding to is, given that states are decently becoming a lockdown, how can people even get anywhere and where can they go? And so that's going to be a work in progress. I think organizations like yourselves are going to be really helpful to see that through. But I think first we actually have to start gathering the information. And so I think ways like, you know, getting resources to people. And once we get emails from people and we get phone numbers, we're going to start to actually text people and email them information. And so they can reach out to us and they can reach out to other organizations that we can get them into contact with, and have those kind of resources. So it's a concern. We're in the very early days of this. If this goes on for several months, there's going to be more of that. I mean, again, as evidenced by the fact that I have a little free library in my living room because someone literally ripped it off of its post in some sort of a anger rage and threw it on the ground in New Brighton, St. George. And we're very early in this. I think we can potentially see where some of this is going. So we need to work as a community to get people the kind of resources that they need to be able to reach out. Any other questions? And I'll make all these resources available to people, by the way. So I'll have a list of resources, and then we can add to them as we continue. Anybody else?
I see that Sentanji is on the line from Charles Falls office.
Okay.
Sentanji, do you have any updates from the assemblyman that you would like to share with us at this time?
You want me to? I can take her off mute. Sentanji, do you want me to take you off mute?
Hello. Oh. Yes, sorry.
Hi.
Hi.
I hope you found that helpful.
Yes, no, that was really helpful. And you know, it's always grateful to have just you kind of providing some of those quick facts and just so the advice to everyone. I know this is a very confusing and difficult time for a lot of people in the community. You know, none of us have kind of been through this before, so we're going day by day to just, you know, to do what's best for our families, communities, and stuff. So, you know, our office is always here, and just wanting to connect with everyone that was available to participate in this. So thank you.
Okay, great. And, you know, I mentioned the resource survey that we're doing, and I mean, we will definitely be, you know, no good deeds in Chachi. I mean, we will definitely be reaching out to Assemblyman Fall's office, for example, to coordinate resources, right? So we have constituents with a specific need. I'm sure we will be reaching out to you to say, hey, we've got these 10 constituents that all seem to have the same need. Can we brainstorm how to get it to them?
Exactly. And I think I had shared it, but you know, it always gets lost in the multitude of different things that are being shared on Facebook and public platforms now. But we have like a questionnaire link that allows for people to submit Google form questions to our office directly in case they either, you know, want to just remain anonymous, or if they have specific questions and they want to make sure it gets to us, that we have that link, and I can, you know, give that to you in an email so that if anyone ever needs to, you know, send us a question, they can put it in there, and we're checking that throughout the day.
Yeah, that would be great.
Mm-hmm.
Yeah, that would be fabulous. That'd be fabulous. So,
yeah.
Okay, anybody else have any concerns or questions? I'm actually gonna copy the chat so that I can follow up with all the questions that have been asked, and then I will link up with SIPCW to give feedback based on that, okay? All right, good, and it's 2:00 on the dot. How about that? So we're gonna end right on time. So if you have any other questions, I'm gonna put my email. There's my email. Oops. Hold on. I just sent it just to Adrian. I'm going to send everybody my email. I'm also going to give you my, there's my phone number, and there's my email. So feel free to be in touch with me if you have any other questions. And I look forward to potentially I'll be doing webinars forever. I'll be doing webinars for a while. So I'm happy to give you links to that information and other programming we're doing for youth. And then, you know, I look forward to being in touch with you and hearing more from you. Okay. Thank you, everybody. Thank you.